So Prince is a transplant coordinator with UCSF Kidney and Liver Transplant Center and will be our speaker today. Also, Jackie is joining us. She is a staff transplant educator at UCSF. She will be answering questions in the chat and maybe chiming in the QA time as well. Thank you both for taking time out to join us today. And now I will hand it over to you, Prince.
All right.
Stop share.
Right, let me just share my screen. Okay. Thank you so much, Doris, for that wonderful introduction. Thank you, NKF, for organizing this webinar series for our patients. Before I start, I just wanted to share a bit more about my personal journey and how I got into the world of nephrology, such as dialysis and kidney transplantation. Kidney disease have touched members of my family. I have an uncle who is fortunate enough to get a kidney transplant, and another uncle who is also in the transplant list, waiting for a kidney transplant. And lastly, my late grandfather, who passed away due to complications of kidney disease. When I was young, I saw my grandfather do his dialysis treatments, and I got fascinated on how the dialysis machine works and its capability to extend other people's lives. So ever since then, my entire nursing career has been dedicated to the field of nephrology. Kidney disease has been close to my heart, and I made it as my personal mission to help my patients and this community. So I am very grateful for MKF for providing me this wonderful opportunity. I do not have any financial disclosures. Currently, I am employed as a transplant coordinator at University of California, San Francisco. Prior to this, I used to work in dialysis. I may cite some examples that are specific to our transplant center. It is always best to consult your transplant center to verify specific information or criteria. Okay. When I was preparing for this presentation, I thought about what type of basic information someone needs if they are to consider kidney transplant as a treatment option for their kidney disease. So with this presentation, I'm aiming to provide you an overview of what kidney transplantation is, what happens during the referral and evaluation process. And I also want to provide you some helpful tips and resources on how to prepare for a kidney transplant evaluation. So what is kidney transplantation? The transplant surgery is performed under general anesthesia. The operation usually takes about 3 to 4 hours. The kidney transplant is placed in the front part of your lower abdomen, in the pelvis right there, near the groin, right? The original kidneys are not usually removed unless they are causing severe problems such as uncontrollable high blood pressure, frequent kidney infections, or when they are greatly enlarged, just like what we see for polycystic kidney disease, right? The artery that carries the blood to the kidney and the vein that carries the blood away is surgically connected right there, okay? To the artery and vein already existing in the pelvis of the recipient. And the ureter, or tube that carries the urine from the kidney, is connected to the bladder. And recovery in the hospital is usually about 3 to 7 days. After this transplant surgery, patients may have a bladder catheter for about 2 to 3 days, and this is to drain out all those blood clots. Also, patients will be on lifelong immunosuppression, which we also know as anti-rejection medications, which would help to prevent and treat rejection. They are necessary for the lifetime of the transplant. If these medications are stopped, rejection may occur and the kidney transplant will fail. Okay. And lastly, it takes about 6 to 8 weeks to have full recovery from the whole procedure. Right. And I just want to acknowledge how busy this slide is, but if there's one thing that I want you to take away from this slide is that transplant has been around for several decades already. Kidney transplantation has come a long way from the very first successful kidney transplant on the identical twins in the 1950s um, to advances in immunosuppression, such as cyclosporin, tacrolimus, and there's also some advances in donor resources, such as expanded criteria programs, such as HIV or hepatitis C donors, where in the past we used to just discard all of these kidneys. Or for living donation, we now have the paired kidney exchange program or the swap. Before, if a living donor is not compatible with the recipient, they just get declined to donate. Now we have this paired kidneys exchange program or the swap where we could swap donors. Um, and lastly, also a voucher program as well. There's also innovation in surgical techniques such as laparoscopic nephrectomy for living donors, all of which have led to improved outcomes such as less chances of rejection, infections, and longer transplant graft survival. Okay. And looking ahead, there are emerging innovations such as artificial kidney, xenotransplantation, etc. Since I'm on this topic, it is important to share with you that these options are still under research and is not yet an available option for our patients. Truly, the best option for all of our patients is still living donor kidney transplantation, not only because transplant may potentially occur within a year, it is also the best kidney that our patients can get because it lasts twice as long as the deceased donor kidneys that a patient would normally get from the kidney wait list. Okay. All right. Now here's something that I wanted to share. When I used to work in dialysis, someone told another patient to consider transplant since they will be under anesthesia. They just close their eyes and ta-da! You have a new kidney. Well, it doesn't really work that way. So it is important for everyone to know that since kidney transplant is a major surgical procedure and transplant patients will be on lifelong immunosuppression or anti-rejection medications, you need to understand that transplant is not risk-free. Although these risks are pretty small and would depend on each patient's medical history, and this will also be discussed during the patient's evaluation, as someone's risk depends on each of the patient's medical, surgical, and family history. Okay. All right. But here are just a few common risks I wanted to point out based on my past patient encounters. Number one is rejection. Rejection is an expected side effect of transplantation, and up to 30% of people who receive a kidney transplant will experience some degree of rejection. Most rejections occur within 6 months after transplantation, but can occur at any time, even years later. So prompt treatment can reverse the rejection in most cases. That's why we want to emphasize the importance of our patients doing their follow-up visits and lab testing, because that's how we can track down those signs of rejection. And if we see some signs of rejection, we would easily adjust the anti-rejection medications or perform additional testing. Okay. Another risk for transplantation is reappearance of the original kidney disease. And this is pretty common for if the cause of your kidney disease is FSGS or IgA nephropathy. If you have kidney disease because of diabetes or hypertension, if your blood sugars or your blood pressure is still not under control after the transplant surgery, it may damage the new kidney transplant again, and your kidney may fail again. All right. Another thing is infections. Since patients are on immunosuppression meaning it suppresses your immune system. That's why a lot of our patients are advised to wear a mask, we advise our patients to complete their vaccinations before getting a kidney transplant, because the anti-rejection medication suppresses their immune system, right? There's also, the patients may also develop high blood pressure, diabetes, or high cholesterol. And this is because of the anti-rejection medications that they'll be taking. So if they do not have any high blood pressure or not diabetic before kidney transplant, they may develop it later on. And cancer is another risk of immunosuppression, particularly for skin cancers or lymphoma. This is why we tell our patients to have a regular dermatology follow-up and have some sun protection after the transplant surgery. Now, there's other possible risks from a psychosocial standpoint, and these are depression and anxiety. Some of our anti-rejection medications are steroids in nature, so they tend to offend your mood. So if you have some depression or anxiety right now, it can make it worse post-transplant. That's why we always recommend for you to establish care with a mental health specialist before a kidney transplant if you do have some depression or anxiety or any type of mental illness, right? Post-traumatic stress disorder, particularly for the patients who may encounter complications or have prolonged hospitalizations, right? Feelings of guilt. For some of our patients, it may be difficult to accept the fact that they are about to receive an organ from a dead person or even from a living person if it's for a living donor kidney transplant. So some of our patients, they do feel that guilt. Again, it's important to see a therapist or establish care with a mental health provider. Future problems may not be covered by the insurer, and this depends for each patient's insurance, right? Alternative financial resources. You may need to find ways to pay your copay. Future attempt to obtain medical, life, or disability may be jeopardized, particularly for our patients who are on dialysis and on disability benefits. Those benefits may go away after receiving a transplant because you won't be on dialysis anymore, right? So this is why it's best to check with your insurance first about cost and coverage. You can also consult your social worker or have them send a referral, and the transplant center's financial counselors will be able to determine whether you have sufficient financial income or insurance to cover the transplant costs, such as testing, evaluation, surgery, hospitalization, and post-transplant medications. Despite all the risk, when you get a kidney transplant, there are a lot of benefits. One of my favorite things about my job is when our patients share their pictures of them traveling and doing all sorts of activities. Because when you receive a kidney transplant, this allows restoration of renal function, including hormonal and regulatory roles not substituted by dialysis. Example is better blood pressure control. It improves anemia and mineral bone metabolism. This is your calcium and phosphorus balance. So if you're in dialysis, you review this every month with your dietitian, right? It also offers fewer lifestyle and dietary restrictions, particularly for our dialysis patients. They have to be on dietary and fluid restrictions because there are some days or times, specifically on non-dialysis days, when their system is not getting cleaned by the dialysis machine, and all of those toxins or excess fluids just pile up in their system. Lastly, by getting a kidney transplant, it is associated with longer survival and improved quality of life because you're not hooked up in the machines the whole time. You're able to do more activities such as travel or even go back to work. So what are the sources of kidney transplantation? First one is from a deceased donor. A deceased donor kidney comes from a person who has suffered brain death. The Uniform Anatomical Gift Act allows everyone to consent to organ donation for transplantation at the time of death and allows families to provide such permission as well. Um, After permission for donation is granted, the kidneys are removed and stored until a recipient has been selected. So, what is a deceased donor? This is from someone who has died and previously chose to donate their organs. That's why we call them deceased donor. Um, and these are the organs that patients on the wait list are gonna get. Okay, so if you're in the wait list, you're gonna get a deceased donor. Okay. Transplant occurs when a suitable donor becomes available, and this can be at any time of the day. We may call the patient at 2 a.m. and we may ask them to come to the hospital as soon as possible, right? And for deceased donor kidneys, it may take many years before patients start receiving an offer, and this is because of the organ shortage. Okay. Now, living donor. Now, who can be living donors? It's anybody who's 18 years old and above. Of course, the donor must be in excellent health, well informed about transplantation, and is able to give an informed consent. So any healthy person can donate a kidney safely. This is often from someone who is related or known to the recipient, but they can also be anonymous or what we call altruistic or non-directed donor. Living donation could result in surgery within a year. Okay. Typically, it yields better outcomes. Living donor kidneys, on average, they last about 18 to 20 years. Deceased donor kidneys only last about 9 to 10 years on average. But those are just average, not to say that we have seen patients who have had their deceased donor kidney transplant in the past that it could last up to 20 years because it all depends on the type of donor and with the recipient on how well they take care of themselves, right? Okay. Living donor kidney transplant has fewer complications. And if a donor is not a match for a recipient, they may enroll under a paired kidney exchange program or the swap program, which I mentioned earlier. A quick example of this is, for example, your cousin wanted to donate a kidney to you, but you're not a match. A friend of mine wanted to donate a kidney to me, but we're not a match as well. So what we can do is we can do that swap program. Your cousin can give their kidney to me, and my friend can give their kidney to you. So everybody gets a kidney transplant. So that's the simplest way I could explain the paired kidney exchange program. We'll be talking more about living donation and the types of living donor kidney transplants in the future sessions. Also, a common question from a lot of our patients, they're asking who's responsible for a living donor. To answer that question, the patient is responsible to find or identify their living donor, and it's not the transplant center. Okay. Caregivers or family members can advocate for the patient to help find living donors as well. All right. All right, here's another statement or another comment that I usually hear from our patients. My doctor referred me for kidney transplantation, which means I'm already on the transplant list. Or I'm already on dialysis, which means I'm automatically on the transplant list. So the fact is, patients with kidney disease need to complete the full evaluation, and they have to meet the selection criteria in order to be listed and start accruing time on the wait list. Now, for patients on dialysis, the patient can get their wait time backdated to when they first initiated their chronic dialysis. I said chronic, not acute. Chronic means permanent, acute means temporary. Temporary because some patients are on acute dialysis, which means it's only temporary because there's a chance that their kidney function may still recover. But again, I want to emphasize that the patient can only be listed after they have completed their evaluation. So sending a referral is not enough. You, the patient, have to complete the full evaluation before being listed on the transplant list. Now, what happens in an evaluation? Everything starts with a referral. right? This can be from any physician, social worker, case manager, or in some cases, patients can self-refer themselves to a transplant center. Traditionally, most referrals are sent via fax, but you can start to see more and more transplant centers are transitioning to electronic means, such as a referral portal or a website. And this is to protect the health information of our patients, and it also expedites the processing of records. After a referral is sent, your nephrology office or your dialysis clinic is supposed to send in records. We then review all those records, and I want to emphasize how important it is to receive all complete records, because this is to prevent delays for the patient to get evaluated. Now we go through the evaluation itself. A patient is to undergo an evaluation by the transplant interdisciplinary team. You have to be seen by a transplant physician, either a transplant nephrologist or a transplant surgeon, or both. You will also be seen by a transplant social worker and a transplant nurse coordinator. And lastly, you will be required to complete some lab testing, such as HLA antibody testing, your blood type, serology, some infectious disease stuff, which, by the way, does not require any fasting or holding any of your medications. So those are the main things that needs to be completed by our patients in order to get placed on the list. Okay. The evaluation can be done via telehealth or in person in the clinic, right? Some transplant centers may require the patient to undergo a series of testing, such as a CT scan, a chest X-ray, an echocardiogram. Basically, most of it are heart testing to make sure that your heart function is okay to proceed with transplant, and some imaging to make sure that there is a place where we can transplant that new kidney, and to make sure that there are no abnormalities in the anatomy. Next one is living donor evaluation. If you have any potential living donors, I just want to point out that some transplant centers do not initiate living donor testing until the recipient completes their evaluation. Okay. And I also put possible re-evaluation on here, given the long wait times, and some of the testing may not be updated. So it might have been 5 to 8 years since the patient was evaluated. Of course, we need to re-evaluate the patient again to make sure that they are still a candidate for kidney transplant. And lastly, hopefully they go through the transplant surgery, whether it's for a living donor kidney transplant or be called for an offer for a deceased donor transplant. My fellow committee member, Yuharn, will be talking more about the evaluation process and required testing on an upcoming session, I believe in May. All right. When we are evaluating a patient, what are the things that we are looking at? When you see the transplant physician, you will undergo a physical assessment, making sure you are able to undergo and withstand the transplant procedure itself, and you have low risk of long-term morbidity and mortality, meaning getting sicker, or whether you have a risk of dying if you were to undergo kidney transplant. They will do an extensive review of your medical, surgical, and family history. They will assess any potential risk and absence of defined contraindications to transplant, which I will discuss further on the next slides. Another thing that transplant centers check is the patient's physical function. Transplant centers use various tools to assess our patient's physical function. Some transplant centers may ask the patient to walk around the clinic or go up and down a flight of stairs. For patients who have neuro or muscular disease or have undergone an amputation, we assess whether they're able to do their activities of daily living. Are they able to transfer out of their wheelchair on their own? Are they able to dress or undress on their own? If they are unable to, do they have a reliable support person? And why do we check the patient's mobility? This is to make sure that you are strong enough to go through the surgery itself. right? And also, right after the transplant surgery, we're not going to let you lie down the whole time because you will be at risk for bed ulcers, pneumonia, and other infections. Uh, we may be asking you to walk around the floor after the transplant surgery or a day after the transplant surgery. Another part of your evaluation is the psychosocial assessment when you get to see the transplant social worker. Um, they will check your psychiatric history. Do you have any depression and anxiety, as I mentioned earlier? They will check your compliance. Are you following all of your doctor's orders? Are you cutting down or cutting your treatments short? Or are you missing your dialysis treatments? They will also check your motivation. Why do you want to do this kidney transplant? They'll check for substance use, and of course, availability of a post-transplant support. And I want to emphasize on post-transplant support because you can be a healthy and young transplant candidate, other than the kidney disease, of course. But if you don't have any post-transplant support, you cannot be a candidate for transplant. And there will be more on this on a separate session, and where we'll talk about the psychosocial aspects of a kidney transplant candidate. And lastly, financial counselors will assess whether you have enough income and insurance to cover the cost of transplant surgery or anti-rejection medications. Now, I just want to draw your attention back to this illustration. You, the patient, being the center of the evaluation, sometimes you have to advocate for yourself, right? Your transplant candidacy would depend on how you would respond to our communication, attend to your appointments, and complete the required testing for your kidney transplant evaluation. I place the caregiver and support system and nephrologist and dialysis team on each side because they're kind of like wings that carries our patients, right? Um, your caregivers and interdisciplinary care team, such as nephrologists, dietitians, social worker, dialysis nurse, PCTs, they're there to support you to help maintain your candidacy for kidney transplant. But ultimately, it all depends on you as the transplant candidate. All right, here's another statement that I get from our patients. I'm already on the wait list, so I'm guaranteed to receive kidney transplant. The fact is, because of the long wait times on the deceased donor wait list, some patients have a higher risk of getting sick or dying while waiting on the wait list. Now, what is the deceased donor wait list? Once you pass the evaluation, you are then placed on the deceased donor wait list. Most people in the United States wait about 4 years to get a kidney from the wait list. Some people wait longer. The average wait time will vary depending on which transplant center you register with. It could be anywhere from 4 months to more than 6 years. In California, some transplant centers' wait time could go up to 8 to 9 years. And while waiting, 1 out of 20, which is 5% of kidney patients, die each year while they wait for a kidney. And if you're diabetic, your risk of getting sick or dying on the wait list is 10 times higher. The patients placed on the wait list and how long they will have to wait for a kidney depends on a lot of factors, such as how long you have been on dialysis. For example, your blood type is O, so the wait time in California is about 8 to 9 years, and you've been on dialysis since 2014. So essentially, you have 10 years or 10 points already. So that would bring you all the way up to the list, and you may start receiving some kidney offers. If you haven't started dialysis, you will start accruing time after you have completed the evaluation and you are placed on the wait list. Another factor that would affect your wait time is your blood type. People with a blood type that is more common works better than other blood types, usually wait less time for a kidney. Another thing is your age. You are usually matched with a donor closer to your age. Having certain antigens and antibodies in your blood Antigens such as diseases or poisons come from outside your body. Antibodies are proteins, or we also call them soldiers in your body that attack antigens to protect from disease. If you have had an organ transplant before, um, you may develop some antibodies or these soldiers. Uh, Also, if you have had diabetes or how far you live from a possible donor. If you look at the right over here, if you look at the chart on the right, I just want to emphasize the proportion between the number of patients listed, which is in green, about 100,000 patients are on the wait list, versus the number of patients getting a kidney transplant, which is in the brown, which is in the 16 to 18,000s, right? 100,000 are on the list. 16 to 18,000 got deceased donor kidney transplant, and only about 6,000 receive, which is in the orange right there, if you can see it, receive a living donor kidney transplant, right? The reason why there's a long wait time is because we're not transplanting enough patients. And the reason why we're not transplanting enough patients is because we don't have enough donors. One way you can help is when you get back to your community, you can help by raising awareness about this organ shortage and encourage everyone to be a donor. You can also support advocacy groups such as the ones that NKF has, or vote on bills that support organ donation and kidney transplantation. Right. After you receive a transplant, you need to understand that there's some responsibility that comes along with it. As I mentioned earlier, hospital stay can be for several days to a week, depending on how quick or you recover or if there are any complications later on. You will also be on lifelong anti-rejection medications. After discharge, you may be prescribed other medications such as pain medications, antivirals, antibiotics, antacids, etc. There's also a frequent follow-up or checkup for the next 6 to 8 weeks. Sometimes we may ask you want to come back to the clinic 1 to 2 times per week to get your follow-up to make sure that surgical wound is healing perfectly. There's no signs of any infection, right? And also patients with a sleepy kidney. Sometimes the kidney doesn't work right away after the transplant surgery. We also call this delayed graft functions or sleepy kidney, right? And for those patients, they may need to be on dialysis for a few days to several weeks. And this mostly happens with deceased donor kidneys, and it rarely occurs with living donor kidney transplants, which is another reason why living donor transplants are better. Since we discussed about the risk earlier, it is important for our patients to maintain a healthy lifestyle. They should maintain low sodium and low calorie diet to avoid the risk of diabetes, hypertension, and maintain a regular exercise regimen. Consider that kidney like a little baby that you need to take care of. All right. Now, how to get referred for kidney transplant. Once your kidney function starts dropping below 30, start talking to your healthcare provider whether a transplant is an option for you. A referral can be from a physician, social worker, case manager, or in some cases, patients can self-refer themselves. But it is important to know that some insurances require a referral from a nephrologist or physician. And these are the most common contraindications to a kidney transplant referral. I tried to make it as generalized as possible, so I created this list from various transplant centers and KDIGO guidelines. KDIGO guidelines are clinical practice guidelines in kidney disease. They are developed and implemented by a global nonprofit organization called KDIGO. They aim to provide evidence-based recommendations for clinicians and patients on how to prevent or manage kidney disease. In 2020, they released these guidelines on how to evaluate a kidney transplant candidate. So one contraindication is if your kidney function is too well. right? Per KDIGO guidelines, if your GFR is over 30, you're still too well to be referred for kidney transplant. But make sure to check with your transplant center. For example, at my transplant center at UCSF, our GFR cutoff, GFR or kidney function cutoff to be referred is 25 or below. So once your kidney function drops to 25 or below, you can be referred for kidney transplant. It is also important to note that patients that are not yet on dialysis, in order for them to start accruing wait time on the list, their eGFR needs to be less than 20 or below, or less than 20. Um, so for patients not yet on dialysis, sure, you can be referred, you can be evaluated, and you can even be placed on the list, but you won't start accruing wait time until your GFR or kidney function drops to 20 or below, right? Another contraindication is obesity, because it is associated with peri and post-operative poor outcomes, such as prolonged exposure to anesthesia, prolonged healing, and infections. So, but I would ask you to please refer to your transplant center, as each one have their own specific BMI criteria for referral listing and transplantation. Another contraindication is active malignancy. If you have active cancers, this is an absolute contraindication for transplant. You can't be referred for transplant until you have been in remission after a potentially curative therapy such as chemotherapy or radiation therapy. Another contraindication is uncorrectable vascular disease. This is for candidates with uncorrectable symptomatic heart disease. If you're having some chest pain, if you have severe heart failure, your ejection fraction from your ejection fraction is your heart function is less than 30%, right? Or if you have severe valvular disease. So those are all contraindications for transplant. Another thing is if you have active systemic infections, right? You can't be referred for kidney transplant until those infections has been cleared up. Here's another thing: frailty or poor functional status. Patient determined to be frail at the time of transplant have greater rates of delayed graft function or the sleepy kidney. They have longer length of stay in the hospital and have a greater incidence of risk-adjusted graft loss and mortality. So your kidney function may fail, or may lead to death at times. Furthermore, frailty appears to increase immediately after transplant, returning to baseline values after 3 months. And lastly, I just put age on here, but for clarification, transplant centers do not exclude a patient from getting a transplant based on their age alone. However, since areas like California has such a long wait time on our deceased donor wait list, and since there is a strong evidence of risk for older patients getting sicker or dying while waiting on the wait list, some transplant centers set up age limits, such as, if you're over 70 years old, right? Some centers do not place the patients on the wait list, although they will consider these patients for kidney transplant if they have living donors. This is because living donor kidney transplant can be done sooner and have better quality compared to deceased donor kidneys. Please note that all of these guidelines are based on studies of certain populations. If you feel that you are an exception from these criteria, you can advocate for yourself by talking to your physician and have them write a letter of exception, including supporting documents, and it can be reviewed by the transplant medical team. For example, if you are a 72-year-old patient, but the transplant center does not evaluate patients who are over 70 years old unless they can find a living donor, your doctor can send a letter of exception stating that, hey, you may be over 70-year-old, but you are active, you don't have any heart disease, you're not diabetic, and you can still run marathons. Okay. Other contraindications for a kidney transplant referral: non-adherence or non-compliance, poor adherence to immunosuppressive immunosuppressive medication is one of the most important factors limiting graft survival. So if you're non-compliant right now, if you, like I said earlier, you're not completing your dialysis treatments, you're not following fluid and dietary restrictions, that's a contraindication for us to consider you for transplant because we need you to follow all of our treatment recommendations in order for your kidney transplant to live a lot longer, right? If you have any untreated psychiatric illness, since, as I mentioned earlier, the anti-rejection medications that you'll be taking are steroids in nature, they tend to affect our patient's mood. So if you have depression or anxiety right now, it may worsen after the transplant surgery. If you have current substance abuse, if you have alcohol abuse, tobacco use, and other illicit drug use, so that's also a contraindication. Now, marijuana use may be contraindicated depending on whether it is legal in your state or it is prohibited by your transplant center. If marijuana is allowed, we recommend our patients to take it in edible or pill form, as smoking and vaping marijuana increases our patients' risk for aspergillosis, which is a very nasty respiratory infection. Other psychosocial issues such as lack of post-transplant support, unstable housing. Why unstable housing? Common question from our patients and dialysis social workers. The patient just underwent a surgery and has an open wound. Of course, the patient needs a clean running water to maintain good hygiene, and this is to prevent infections. If transplant does not work out for you, there are other treatment options. I won't dive into this more since this is something that you can discuss with your nephrologist or even your dialysis clinic, right? As I mentioned earlier, there's kidney transplantation, there's hemodialysis, peritoneal dialysis, home hemodialysis, nocturnal dialysis, or for some of our patients, they choose to do nothing. They can be on palliative or hospice care. And of course, if you opt out for any of the treatment options for end-stage kidney disease, that could lead to death. Now, here are some helpful tips that can help you prepare for a kidney transplant evaluation. Make sure you educate yourself and obtain reliable information about kidney transplantation. The best source is your local transplant center. Make sure while waiting for the referral, identify a living donor. Who can be a living donor? Anybody who's 18 years old and above, and they cannot be diabetic. Those are the two basic criteria that you can remember. Like I said earlier, they don't have to be a match for you in order for them to become a living donor. Establish your post-transplant support. It can be anyone who can provide you support, particularly transportation to bring you to your follow-up appointments, to drop you off at the pharmacy, the lab. It should be someone who can watch over you, because if you have some sort of reaction with your medications, or if you develop an infection and you start getting confused, somebody has to be able to watch over you and take you to the hospital if needed, right? Consult your social worker or ensure whether your insurance is adequate for kidney transplantation. And as I mentioned earlier, abstain from tobacco or illicit drug use. Follow all your doctor's treatment recommendations. I can't emphasize this enough. Compliance is very important to maintain your kidney transplant. Live a healthy lifestyle by adhering to proper diet and a regular exercise regimen. And lastly, list down all of your questions. The best time to ask those questions is during the kidney transplant evaluation, when you see the kidney transplant doctor, the social worker, the transplant coordinator. List them all down, and they'll be happy to answer all of your questions. After learning about kidney transplant, some patients become hesitant to consider kidney transplant as an option. There are times when I have to talk to these patients before being referred. So if you have any doubts or concerns about your medical history or whether your insurance will cover the transplant cost, just consult your transplant center by getting referred to your by your provider. And it's also important for you to know that you have the right to refuse at any time of the process. If you feel like transplant's not for you, you can you can refuse it and you can just stay on dialysis. All right. So there's no commitment, no penalties whatsoever. And here are just some resources for me to share to you. If you go to the SRTR, this is the Scientific Registry of Transplant Recipients. This is where you can search for transplant centers near you to know where you can be referred. And it also includes how many living donor or deceased donor transplants they do in a year, the transplant ratings for 1 year survival, and how fast you can get a kidney transplant from a deceased donor. Also, on the same website, you can also make use of this kidney transplant decision aid. You can find this section by looking at the screenshot over here. This provides the patients of how likely they are to get a kidney transplant from a deceased donor by specifying your age, your gender, and you can specify, how many years to predict. In 1 year, 2 years, what are my chances of still waiting in the wait list, or maybe getting sick or dying while waiting on the transplant list, right? Here are just some other resources that I could share to you. Make sure to visit them. And here are also some support groups. NKF is a good one to make use of. Here are my references. And here's my contact information. You can connect with me through LinkedIn. If you have any additional questions, you can scan the QR code or follow the LinkedIn link over here. And now I'm ready for questions.
Okay, well, Prince, thank you so much. As a transplant recipient myself, like 7 years ago, there's so much information that I wasn't even aware of. So really great information. So we had a very, very robust chat, lots of questions. And even before today, we had a lot of questions submitted. So I'm going to present those first and then go to the ones in the QA. Just a reminder that all the QA questions, even the ones that Jackie answered, we will include that in the follow-up. So if you're not like I was not able to follow the chat and follow Prince's presentation, you'll have all that information. Okay, so we had a lot of age-related questions. You addressed that already. But let's see. One follow-up is what percentage of people over 70 years of age receive kidney transplants versus those under 70 years of age?
So based on the 2022 SRTR data, it's not, they didn't really specify patients who are over 70 years old, but they did specify patients who have received a deceased donor kidney transplant over 65 years old. And that amount is about 24%, or 4,700 patients who received a deceased donor kidney transplant. And about 21%, or 6,000 patients, receive living donor kidney transplant who are over 65 years old and older.
Got it. Okay, great. Let's see. Is there an age limit? You answered that. Can you receive over 70? Yeah, you answered that. But what part does Blue Cross Medicare cover?
Yeah, as I mentioned, this is not
Yeah.
really my expertise, so I would always advise you to contact your insurance provider as to which they would cover for your kidney transplant.
Yes. And I will also add that we are planning actually a patient webinar later this summer on financial considerations, followed up with another one with a deeper dive into Medicare. So please be on the lookout in your email for that. Okay, next question. Can an individual be worked up for the kidney transplant? Just worked up, not get a transplant before reaching GFR of 19. And I know you touched on that.
Yeah, and the quick answer is yes, but we do not recommend it, as the workup may need to be repeated, as they have to be fairly recent or updated at the time of the transplant evaluation.
Okay, very good. How are people prioritized for kidney transplants? I know you touched on that, but maybe talk a little bit again about the point system.
Sure. And so it's all, as I mentioned earlier, it's all based on a point system where 1 point is equivalent to 1 year Each point depends on when the patient started chronic dialysis or when the patient is placed on the list if they're not yet on dialysis. And this is right after the patient completes the evaluation. The only priority given on the kidney wait list are for patients who are younger than 18 years old or if they have donated a kidney in the past. So if they were a living donor in the past, they get automatic priority on the list.
Yes. Um, okay, when it comes to someone needing a second kidney transplant, what kind of obstacles occur? I have heard it is harder to find a match because of antibodies that have built up.
Okay, good question. Patients who have had a sensitizing event, such as having received a transplant, having a history of pregnancy, or history of severe infections, those patients may develop antibodies, which may make it difficult for our patients to find a match on the wait list. Antibodies are the cells in our bodies that act like soldiers that protects our body from any infection or foreign invaders. In the world of transplant, a transplanted kidney is considered a foreign invader. This is why the higher your antibody level, which means the more soldiers that you have, the harder it is for you to find a match because they're overprotecting your body, right? Yeah.
I like it when you use metaphors like soldiers, because that
Yeah,
I get. Yeah.
I do my best.
Yeah. How close do you think we are to having an artificial kidney or using xenotransplant?
Another excellent question. Unfortunately, both are still under research phase, and it may still be several years before they can be deemed safe to use by our patients. So right now, the best option remains to be living donor kidney transplant.
Okay, another one, bone marrow transplants between living kidney donors and the recipient. Do you see this becoming part of the standard process to reduce or eliminate the use of anti-rejection medications?
So I personally do not know much about this, but I have read some cases where a close relative, such as a sibling or identical twin, initially donated a bone marrow to their own relative and subsequently receive a kidney transplant with minimal to no immunosuppression. But one thing that you have to know is even with bone marrow transplant, there is still a high risk of rejection. So I don't think that this will be a standard process in the near future unless there's a new breakthrough on immunosuppressive therapies.
Hmm. Okay, that's an interesting one. This next one I hear a lot. I'm on dialysis, but I'm not sure if I'm on the wait list.
Yes, and I kind of touched on that earlier with the myths and facts as well. If you haven't been referred and have undergone a kidney transplant evaluation, then you are most likely not on the wait list, right? As I mentioned earlier, you have to go through those process in order for you to be placed on the list. Not just because you're on dialysis, you're automatically on the wait list, right? So kindly consult your social worker or transplant center to confirm that whether you are on the list or not.
Right. Okay, we're running short on time, so let me see. What is the likely life expectancy of kidney transplant patients in years?
All right, so life expectancy is not something that can be predicted for kidney transplant patients, as life expectancy depends upon each individual patient. Like I said earlier, the medical history, the age, all of those things. It is best to consult your physician so they can provide more information about the possible risk for getting sicker or dying when considering treatment options about your kidney disease.
Mhm. Good. Is there any reliable research currently under process that might improve the health conditions of patients, kidney patients?
The only ones that I am aware of is the ongoing development of the artificial kidneys and xenotransplantation.
Mhm.
Uh, yeah.
Okay. Yeah, and I will add to that that we had a webinar earlier last year on clinical trials and research. So we will include the link to that recording and also the links to different research studies in the follow-up email. Okay, so we are actually coming up on the hour. So I just want to end with a question for you and for Jackie. I'm going to invite you to come on. Is just what one last takeaway you would like for our audience to take away today?
Sure. First one, make sure you obtain accurate information about kidney transplant because you may be missing out on an opportunity to get a kidney transplant if you're getting false information, right? Second one, find a living donor. I can't emphasize this enough, and as you've heard me, I've kept repeating it, living donor kidney transplant is the best treatment option for you. And lastly, if you're in doubt, you don't know whether transplant is for you or your insurance can cover your post-transplant costs or not, just have your healthcare provider send that referral to your transplant center, and they'll let you know, and they'll provide more information about whether transplant really is the right treatment for you.
Right. And Jackie, if you don't mind coming off onto camera and coming off
Hello.
from you, we'd love to hear from you.
I'm the mystery typist.
Yeah.
I would say most questions so I'm going to say it in two ways. For transplant or for professionals, for healthcare professionals out there, if you don't know whether or not a patient qualifies for transplant, oh, maybe they may not have legal citizenship, you're not sure about their financial status, have they waited long enough after their cancer diagnosis? Refer, refer,
Mhm.
refer, refer. Each center varies on their requirements, but you won't know unless you refer. Let the center make that determination. Don't try and figure it all out yourself. And one last little ditty for anybody who is pursuing transplant or living donation. It's kind of random. Don't worry about the blood type. If you find somebody who's interested in donating to you, have that person apply, whether it's through your center, whether it's through the National Kidney Registry. The transplant centers and the NKR will worry about that and can offer different various swaps and things like that. But don't worry, if you have somebody who's interested in donating, have them apply regardless of their blood type. So those would be my 2 points.
Yeah. Okay. Yeah, it's hard to limit it to just one, huh? Or two, or even yeah.
Or
So
10.
anyway, I wish we had more time. There's so much good information. So thank you so much to Prince and to Jackie. I can't tell you how grateful we are. Thank you to our sponsor, UCSF, our planning committee, and all of you for your questions and participation. We had a very, very active registrant list. People sending in lots of questions. We will have another webinar in May, as we mentioned, about the kidney transplant evaluation process, and also one on financial considerations. And then we will have one in the future about living donation. We had one last year about finding a living donation. We will share all those resources. We will include in the follow-up email recording today's webinar, the resources, responses to any unanswered questions, including all the chat QA that Jackie navigated. Please fill out the feedback survey for today's webinar. The link is in the chat. Your input is very important. So share what topics you want to learn more about. It helps us to plan future sessions that are relevant and helpful. And thank you all. Have a great afternoon. Stay safe, stay dry, stay warm, and we'll see you next time.